Hi, my name is Dr. Gallagher, and today I'm answering a very straightforward question I got recently from the YouTube channel, and that is, can we do orchiectomy alone? Can we just remove the testicles for transgender women? And the answer to that is absolutely. It's a much easier procedure. Now, we get two different types of transgender women or trans feminine patients who opt for this. One would be patients who are planning at some point in their transition to undergo either zero depth or vaginoplasty or some sort of more feminizing procedure in the future, but they're either not ready right now financially or socially or mentally to undergo the bigger surgery. So in that case, they will undergo just orchiectomy to help with their affirmation and sometimes also to help with their medications, which we'll talk about in a second. However, there are plenty of trans feminine patients out there who just opt for orchiectomy. And I always say the whole reason we're doing these surgeries is help affirm the patient, and it's not a one size fits all. So what may be affirming for one patient doesn't necessarily fit another, but certainly for some trans feminine patients, the orchiectomy is all you'll need. So let's talk about some facts for this. First of all, the requirements are a little bit less usually depending on your insurance company. So usually most insurance companies follow what we call the WPAT, the World Professional Association of Transgender Health. They follow their recommendations. So usually these are a little bit more lax than full vaginoplasty or zero depth procedures. So it's usually one letter from a mental health professional and one letter from your endocrine provider. Apart from that, it's a much easier surgery to recover from. If you are paying out of pocket, it's a much more affordable surgery as well. So what it looks like for patients is a patient will be able to come in the morning and go home that afternoon. Procedure itself takes about 30 minutes to an hour. The vast majority of patients will go to sleep for this because it is uncomfortable. And how we do it is through a little incision that's made in the scrotum. There will be some changes to your hormone requirements afterwards, and you won't have to take testosterone blockers. So the most common blocker we're seeing here in the United States is spironolactone, and the good news is you won't have to take it anymore because a lot of patients do report some bad side effects with that. So oftentimes your estrogen requirement will have as well. But these are just rough guidelines. You really need to check in with your endocrinologist, who will probably check your levels after the orchiectomy. So orchiectomy is a quick and easy procedure. It's a safe procedure. You do still need letters, but for most insurance companies, the requirements aren't quite as stringent. Downtime from this procedure is not much. You're just recovering from a little incision, and usually it's just a few days off work. So I hope this is helpful.